evening. My name is Kendria Anderson. This is my video discussion board for CEFS on informed consent. According to our text, informed consent is an ethical obligation. The rationale of informed consent is simple. Clients have the right to know what they're getting into when they come in for counseling. Most clients are not counselors, so they must have their counselors provide them with information that they need to make good life choices. Handelsman 2001. When we provide clients with informed consent, we're giving them the opportunity to make decisions freely in their treatment plan. And you're also establishing a client relationship built upon trust when you're putting everything in the first session, going over fees, payments, expectations of the client, the expectations of the counselor, the payment plans, and all of those things like that. When it comes to informed consent, every state is mandated to provide a form of some sort. This allows the clients to gain a clear understanding about the rules and regulations of the therapist practice. In Maryland, the healthcare decisions that are made under Maryland's common law is a doctrine informed consent of mentally competent adult. So here in our state, the client has to be competent enough to understand or make adequate decisions without having someone explain to them in depth what's going on. But if it's a child, then they're deemed as incompetent when they're not of age. And you have to do a little bit more explaining and go into more depth about the care that they are provided. So I think that differs a little bit from other states. So in addition to the ACA Code of Ethics, counselors have the right to either do their consent form verbally or written, but both counselor and client have to understand their parts, and it has to be discussed properly to move forward in the care. So the form that I pulled up from Maryland it has to do with Dr. Lisa A. Linhart and her informed consent. She goes over her treatment options, the therapeutic approaches, the insurance coverage, if you're submitting claims to a company or companies about a brief therapy or acute symptoms. Some of the symptoms may not be covered under the insurance, and then they have to discuss a different method of how they're going to take care of the client. And then they go over confidentiality release, which looks like it's pretty common on a lot of the informed consents, that the information that she gets, she can release it to others in her practice, where you have the right to not have everything. If you don't want a particular medical provider or family member of some sort involved in your treatment plan, you don't have to. But in this particular informed consent, she states that when you provide written consent, you give her permission to discuss the treatment with other professionals that are involved in your care. And that goes for payments and cancellations and statement of understanding at the end. Basically for the client understanding do they agree to these terms. And I think that's how that differs from the Code of Ethics and Maryland's rules and regulations. Thank you.